Stop whatever you are doing right now and do this one thing with me. Take a slow breath in through your nose. Now breathe out through your mouth. And as you do, pay attention to that feeling at the back of your throat. That heaviness, that coating that seems to appear out of nowhere every single morning and refuses to leave no matter how many times you try to clear it. You have been living with this, maybe for months, maybe longer, and somewhere along the way you stopped asking why and started just accepting it. Today, that changes, because what I am going to share with you in the next few minutes is not what most people ever get told, not by their pharmacist, not even by their doctor. And by the time this video ends, you are going to understand your own body in a way you simply did not before. My name is Dr. Leonard. I specialize in functional wellness for adults over 50, and I am going to walk you through the exact biology behind that stubborn throat coating. And here is something your body does every single second of every single day that you are completely unaware of. And understanding it is the key to everything. Your body produces mucus constantly, around the clock, non-stop, and this is not a problem. This is brilliant biology. Mucus is essentially your body's internal security system. It traps bacteria, airborne particles, and viruses before they can travel deeper into your lungs. It keeps the delicate lining of your airways moist and protected. The issue is not the mucus itself. The issue is a system called mucociliary transport. Inside your airways, there are millions of microscopic structures. Imagine tiny, coordinated, sweeping bristles whose entire job is to keep mucus moving, thin, and flowing so it never pools anywhere. In your 30s and 40s, this system is fast and efficient. Mucus comes, mucus goes. You never notice it, but here is what the science tells us clearly. As we move past 55, these sweeping structures slow down significantly, and mucus that would have been cleared in moments at age 40 can now sit and accumulate for hours. This means that any trigger pushing your body toward extra mucus production will hit you harder and last longer than it ever did before. That is the foundation. Keep that in mind as we go through what is actually causing this. The first cause is one that catches almost everyone off guard because it produces zero heartburn. None. No burning chest, no digestive discomfort whatsoever. It is called silent airway reflux. Here is what happens. At the point where your food pipe meets your stomach, there is a muscular closing mechanism. Its entire job is to stay tightly shut after meals, keeping stomach acid exactly where it belongs. With age, this mechanism can gradually weaken. When it does not close properly, stomach acid can travel upward, all the way to your throat, your voice box, and sometimes your nasal passages. Now, your throat tissue has zero tolerance for acid. Even the tiniest trace of acid reaching your throat causes your body to immediately flood that area with thick protective mucus. This is your body trying to protect itself, and when this is happening silently during sleep, every single morning you wake up to that familiar heaviness, with no idea it is coming from your stomach. Ask yourself honestly, is your throat noticeably worse after you wake up? Does bending forward seem to aggravate it? Does your voice sound rough or different in the mornings? These are the quiet signatures of silent airway reflux, and I will give you specific steps for this in the action plan. The second cause is chronic low-level sinus inflammation, and the reason most people miss it is because it looks nothing like what they expect. People imagine sinus problems as dramatic, severe facial pressure, blocked nose, headaches. But in adults over 55, inflamed sinuses very often produce no dramatic symptoms at all. Just a steady, quiet trickle of extra mucus draining down the back of the throat all day long. This is postnasal drainage, and recent research confirms it peaks in exactly this age group. Here is the mistake most people make. They reach for antihistamine tablets from the pharmacy for weeks assuming allergies are the culprit. But antihistamines do not address sinus inflammation. They just thicken and dry existing mucus, which often makes the sensation worse. What research consistently supports instead is a simple daily warm saline nasal rinse. Clinical reviews confirm it reduces mucosal swelling, clears inflammatory mucus, and actually supports the sweeping mechanism we talked about earlier. Affordable, simple, highly effective when done consistently every day for at least 2 weeks. The third cause surprises nearly everyone because it involves medication. people have been taking faithfully for years without ever connecting it to their throat. There is a widely prescribed category of blood pressure medication called ACE inhibitors. Tens of millions of people take them. They work well for blood pressure, but they produce a well-documented side effect. They allow a compound in the body called bradykinin to accumulate, and in a meaningful percentage of users, this creates persistent throat irritation and a relentless urge to clear the throat. Here is why this connection gets missed constantly. The effect can take many months to develop after starting the medication. So if you began a blood pressure pill a year ago and your throat started bothering you 8 months ago, your mind simply does not link those two events. Large-scale studies confirm that adults over 65 experience this effect significantly more often than younger users. Your pharmacist can tell you in 1 minute whether your blood pressure medication belongs to this class. And there are alternative medications, called ARBs, that control blood pressure just as effectively without this specific effect. That conversation with your prescribing doctor Here is what you can actually start doing. Tonight, stop eating at least 3 hours before lying down. Gravity works against you when your stomach is still active and you recline. 3 hours of upright time after your last meal is one of the most evidence-supported steps for reducing silent reflux overnight. Also, slightly elevate the head end of your mattress. Use a firm wedge under the legs, not extra pillows under your neck. Even a small incline uses gravity in your favor while you sleep. Tomorrow morning, before coffee, before breakfast, drink 1 to 2 glasses of warm water. This single habit begins rehydrating your body and loosening overnight mucus accumulation before it sets your whole morning. This week, pick up a nasal rinsing bottle from your pharmacy. Use water that has been boiled and cooled to warm. Add a small amount of plain salt. Use it every single morning. Commit to 2 full weeks of daily use before deciding whether it is helping. Consistency is what makes the difference. Regarding your medication, write down when your throat symptoms started and when you last changed or started any medication. Bring that timeline to your doctor and ask specifically whether your blood pressure medication is an ACE inhibitor and whether an ARB alternative might suit you. For your gut, add 1 small daily serving of a fermented food. Plain live culture yogurt, kefir, a small portion of kimchi or sauerkraut. These are long-term gut microbiome supporters that research links to reduced airway inflammation over time, not an overnight fix, a genuine long-term shift. And hydration, set reminders. Keep water in every room you spend time in. Eat water-rich foods consistently. Your mucus consistency will begin to reflect your hydration within days. Here's what I need you to take away from today. That coating at the back of your throat has a reason. 5 possible reasons, actually, and most people dealing with this have never had a single one properly explained to them. Silent airway reflux with no heartburn. Low-level chronic sinus drainage, medication working exactly as designed, but irritating your throat as a side effect, chronic mild dehydration, running below the level that makes you feel thirsty, and gut microbiome disruption sending inflammatory signals your airways are responding to. None of these require you to simply accept this as your new normal. Each one has a practical, evidence-grounded response. If someone once told you this is just part of getting older, I hope today gave you a completely different understanding, because you are not just aging, you are dealing with specific, identifiable, addressable biology, and you deserve to know that. Subscribe and turn on notifications. I have an upcoming video on exactly how chronic gut inflammation connects to the most common complaints I hear from adults in this age group. You will not want to miss it. And before you